Hi, so I'm going to assess Mustard's thoracic limb today. I'm going to assess each joint individually and work distally to proximally. She is my dog, so I know her behaviour quite well, so I don't actually have another handler with me today, but I will keep an eye for any behavioural responses that may indicate pain. So the most distal joint is the distal interphalangeal joints. There's flexion and extension at these joints, so I'm going to fix that P2. And I'm going to come up into extension, good girl, and down into flexion. She's got quite ticklish feet, so she's not always a fan of me doing this, but behaviour-wise she seems quite happy. So I will work down as much as she'll let me. Good girl. You can do them grossly as well, which is an option if she doesn't like me doing them all individually. I'm adding a bit of overpressure to them and there's no behavioural responses. The next joint up is the proximal interphalangeal joints. So I'll fix P1 and then again come up into extension and down into flexion. Good girl. So she moved the limb away, but like I say, that's more ticklish. That's quite normal for her. And it's the same end feel for all of the joints. Next one up is the metacarpal phalangeal joints. So I'm going to do these ones grossly. Good girl. So up into extension, adding some overpressure, she seems quite happy, and down into flexion. And again, no behavioural response. Coming up is the carpus. So there's actually 3 joints in here, but it's the antebrachial carpal joint which most of the movement comes from. So you've got flexion and extension here. So flexion, she's got a really good amount of flexion, the joints reach, and into extension, just bringing the limb into slight retraction so we're not getting any passive insufficiency. Come up to our elbow joint. If I fix the humerus, and then we come up into flexion, good girl. Just careful not to compress the carpus and cause any discomfort. Good girl. And then into lie down, good girl. Good girl. And then into extension. Also, if I fix the humerus, you get a level of supination and pronation at this joint as well. I can use an objective measure to measure the elbow range of movement using a goniometer. Good girl. Lie down. And I'm going to measure elbow flexion. Bringing the joint all the way up, and I get 32 degrees there. So that's in line with Prydie and Hewett 2015, who say it should be 25 to 40 degrees. Next joint up is the shoulder joint. So if I fix the scapulus, we're getting true glenohumeral joint movement, and I'll bring the shoulder into flexion. Good girl. And then into good girl. Just do that one again, into extension. So yeah, no pain response. Fixing the scapula again, you can come out into abduction. Good girl, just go to your side. Good girl. Up into abduction and down into adduction. And there's also internal rotation and external rotation. So she's got a good amount of movement there. Nice spongy, springy end feel, no pain responses. Coming into the scapula, we can have a caudal glide and a cranial glide. And we can also have some ventral and some dorsal movement. Assessing the whole limb, you can bring the whole limb forwards, and if we just move her head to good girl, into limb retraction, so it's got a lovely reach, and back into good girl, into retraction. She doesn't like the end of retraction, she brings it back. If we just do it again, good girl. So she's not too happy with that. So overall, Mustard's got really good joint range of movement. She's not overly happy with limb retraction right at the end of range. Otherwise, her joints feel good. Otherwise, we would usually compare to the contralateral side, but for our assessment purposes, we've just done the one.